Good evening, I'm Steve Bell. This is the National AIDS Awareness Test. We bring you this broadcast because what you don't know about AIDS can kill you.
I'm Morgan Fairchild. I'm co-anchor of this broadcast with Steve Bell. Now, I've joined the National AIDS Awareness Test because I know that what someone else doesn't know about AIDS can kill you. And some deeply concerned Americans have joined our reporting team especially for this broadcast.
I'm Lou Gossett, Jr., and I'm here in Los Angeles, the #3 city in the United States in terms of AIDS cases, after New York and San Francisco. I'll be a West Coast correspondent in this quest for answers about AIDS.
I'm Susan Day in Washington, D.C. to talk to the Surgeon General about sex, safe sex, and unsafe sex.
I'm Albert Hay. I'll be reporting from the Institute for Immunological Diseases in Houston, Texas, the first hospital in the United States to exclusively treat AIDS patients.
I'm Gregory Hines, reporting to you from the Centers for Disease Control in Atlanta.
The National AIDS Awareness Test, a test of your knowledge about this most important issue of personal and public health. Brought to you in the public interest by the Metropolitan Life Insurance Company. Again, Steve Bell and Morgan Fairchild.
In this broadcast test, we'll be asking you how much you know about this disease. The correct answers, the best available answers, will come from some of the most highly respected medical and public health authorities in the field.
We will also be joined in this broadcast by many people who have their own worries and fears and hopes about AIDS, and will share them with us tonight.
Mayor Dianne Feinstein of San Francisco.
To be promiscuous is to play Russian roulette. There is safer sex, but there's no such thing as perfectly safe sex.
Ed Too Tall Jones.
Of course I'm afraid. I'm afraid of catching anything that they don't have a cure for, especially when I don't know every way to prevent it.
Anna Maria Horsford.
Who gets AIDS? Black women, white women, Hispanic women, babies, little girls and little boys, homosexuals, Haitians, Africans, the human race.
In one respect, we are all learning too much about AIDS, all too fast and all too frequently. Before we begin this National AIDS Test, we want to ask you two very personal questions about the extent to which AIDS has struck home to you. First of all, do you have the AIDS virus, or do you personally know anyone who has contracted AIDS? Think about that for a moment. If you answered yes, if you do have AIDS or you know anyone who has it, you're among 6 out of every 100 Americans who have been personally touched by this disease.
Another question. Do you feel that you or anyone you know personally are at risk of getting AIDS? If you said yes, you are among 15 out of every 100 Americans who look at themselves and their friends and fear that they too could become victims of AIDS.
Every year, more and more people say yes to those two questions. As the disease spreads, it touches more of our lives. Now, the President of the United States.
Today, America faces a serious medical crisis, the spread of Acquired Immune Deficiency Syndrome, or AIDS. More than 40,000 Americans have been diagnosed as having AIDS, and there is no cure. That's why I've declared AIDS public health enemy #1, and why spending on AIDS research is one of the fastest growing areas of the federal budget. I recently appointed a commission of distinguished Americans to see what more we can do to treat, cure, and stop the spread of AIDS. But even before the commission reports, one thing is clear. Each of us has a role in dealing with this epidemic, and that role begins with informing ourselves. Tonight's special AIDS awareness test can be a big step in that direction. In the next hour, you will hear up-to-date information about AIDS. Much of it will be alarming, but I hope you'll keep in mind one important truth. Americans working together can beat any problem that comes our way. And that goes for AIDS, too.
As AIDS becomes an increasing national problem, It's inevitably touched and will continue to touch America's businesses and corporations. One company, Metropolitan Life Insurance, is expressing its concern in a constructive way by bringing you tonight's program. Now a message from the president of MetLife.
We Americans have a saying, "What you don't know can't hurt you." We often invoke this adage in our everyday lives, usually to avoid personal involvement or personal responsibility. Never has that saying or attitude been as wrong as when we apply it to the AIDS crisis. What we don't know about AIDS can hurt us. In fact, it can kill us. I'm John Creedon, president of Metropolitan Life Insurance Company. Tonight's special program is designed to help us learn more about AIDS. The program takes the form of a test. The questions have been designed to determine our level of knowledge about the disease. Then we'll be able to compare our answers to those of the general public, as well as to the answers of leading medical experts. Metropolitan Life is presenting this two-hour program, the National AIDS Awareness Test, in the public interest and with no commercial interruptions. Our reason for doing so is simple. MetLife has a century-long tradition of helping to educate the public on important health issues, and we believe that the AIDS epidemic may well be the most serious health issue to face our nation in this century. We're also concerned that AIDS is being perceived by too many of us as not my problem. If you think that way, you may be wrong. AIDS is not just a gay problem. It's not just an intravenous drug user's problem. It's not just a minority group problem or an East Coast or a West Coast problem. AIDS is a threat to our nation that can touch any of us and all of us. And our only defense at this time is education. So whatever your current attitude or knowledge is about AIDS, I urge you to watch and listen for the next 2 hours.
AIDS, the epidemic.
This is a national test tonight. Tens of millions of Americans are taking this test of knowledge about AIDS. Now, as we go along, we'll be able to tell you how your knowledge, your score on this test about AIDS compares with a national survey. To record your answers, most of you have these score sheets from your local newspapers or magazines. But if you have no score sheet, well, some paper and a pencil will do just fine.
For the facts, for the correct answers to our test questions, we've turned to prominent experts in public health, science, and medicine. Already, we've asked our test questions of a cross-section of Americans with the help of Lewis Harris and Associates, the national polling organization. So you'll be able to tell how your knowledge about AIDS compares to others and what they know in our national sample. We've also put these same questions to high school students in Plainfield, New Jersey. And we also gave the test to some student nurses at the Milwaukee County Medical Complex School of Nursing to see how much they know.
Now for our first scoring questions on the National AIDS Test. If we know these answers, then we're on our way to understanding some very basic facts about AIDS. Pestilence, that fourth horseman of the apocalypse. Pestilence has been ravaging mankind since the beginning of time. Just when we think we have disease under control, along comes another one, cutting through the world's population. Each of them caused by a microorganism which works its way into the body. Sometimes it's bacteria, sometimes a virus, or a fungus, or a parasite.
Question number 1 on the National AIDS Test is about what causes AIDS, a multiple choice question. AIDS is caused by A, a virus, B, bacteria, or C, a parasite. Choose A, B, or C. If you have a printed score sheet, circle A, B, or C next to question number 1. If you're using your own piece of paper, put a number 1 on the page for question number 1, and next to it write the letter for the answer you think is correct. The correct answer is A. AIDS is caused by a virus. If you answered A, you earned 2 points. We'll have more about that virus and more about scoring in just a moment.
Now, our second question is about how the body contracts AIDS. Some diseases, like heart disease, most cancers, develop solely within the body, brought on by diet, heredity, and habits of living. Other diseases spread contagiously from person to person. What about AIDS? Question 2, to be answered yes or no. Is AIDS contagious? Yes or no? The answer is yes. AIDS is contagious. We can pass the virus from one of us to another. Give yourself 2 points if you answered yes, it's contagious. Those 2 answers govern a lot of what we know about AIDS. In fact, even the name tells us a lot. AIDS is an abbreviation, and each letter tells something about this disease. A, acquired. You have to get it from somebody or something. It's not in your genes, it's not inherited. I, immune. It's about your immune system, which is supposed to fight off disease. D, deficiency. That immune system is deficient. If you have AIDS, the immune system does not have the ability to fight off disease the way it should. And S, syndrome. It's not one disease the body cannot fight off, but a group of them, a syndrome. Together, sometimes individually, these diseases the body might normally resist can kill you.
Steve, how did people in our national survey score on those first 2 questions?
Fair to poor, Morgan. Only about 6 out of 10 know AIDS is caused by a virus. But when you look closely at those who say either they have AIDS or know somebody who has it, then the knowledge level goes up. 8 out of 10 of those people know it's caused by a virus. Among our Milwaukee student nurses, 100% got that answer right. Now about whether AIDS is contagious. 8 out of 10 in our national survey know that it is. Our next group of questions is about the spread of this disease, the epidemic. To talk about this and to give us the correct answers, I turn to Dr. Otis Bowen, Secretary of Health and Human Services in Washington. When someone has AIDS, what do we mean?
There are 3 phases of AIDS, actually. The first phase is the infection of the body with the virus. And it's during that phase that one may not have any symptoms at all, but still may be able to transmit the disease. So that's a dangerous time. The second phase is called ARC, or the AIDS-related complex. And it's at that time that one may develop some weight loss, some swollen lymph glands, and night sweats, and some fever, and maybe some skin rash. And then the third phase is the full-blown AIDS, at which time there is wasting away and the development of Kaposi's sarcoma, which is really a form of cancer, or the development of some other disease such as pneumonia, which can be serious enough to take the life.
Our next question is about the last of those, full-blown AIDS, and how far it swept into the United States population. Question 3. To the best of your knowledge, is the number of AIDS cases diagnosed in the United States closer to A, 1 million, or B, 40,000? Please mark your answer for. Dr. Bowen?
The answer is B, 40,000. And of the 40,000 that have been diagnosed in the United States, approximately 23,000 of those have died.
In fact, this epidemic has had such impact on our society that it's difficult to keep it in perspective. In absolute numbers, it's far less devastating than the flu epidemic of 1918, which took 500,000 lives in this country and 20 million around the world. Now, there have been some 23,000 deaths in this country so far from AIDS. Do you know when the AIDS disease was first spotted? That's our next question. Question 4, multiple choice. When was AIDS first identified? A, 1957, B, 1972, C, 1981. When was AIDS first identified? Please mark down A, B, or C. Dr. Bowen, what's the answer?
Well, the answer is C, 1981. It's a relatively recent disease.
How was it spotted?
Well, it was first spotted, I believe, in California by a researcher who found that 2 of his patients had expired from a pneumonia that ordinarily never killed anyone. And the individual physician then made further studies and found out that the immune system of these 2 individuals had been totally destroyed. And then from there, they had to find out why.
Why had it never been spotted before?
Well, I think that it has been a relatively new disease, and where the virus started, I don't think anyone knows yet. There's been some speculation, but I don't think there's any proof as to the real origin.
But then you have to ask, where's it going? How fast and how hard is this epidemic hitting us? Question 5. By the end of 1991, 10 years after the discovery of the disease, the total number of cases of AIDS in the United States is expected to be about A, 50,000, B, 250,000, C, 1 million. Choose A, B, or C. Dr. Bowen, what's the answer?
The answer would be B. Actually, the figures that we are using now is that there will be about 270,000 cases by that time, and some 179,000 of those will have passed away. But the number of cases that develop in 1991 probably are those that have the virus in their system today.
Is that inevitable?
The number in 1991 is almost inevitable unless we find some cure for those who have the virus in their system at the present time.
So how many AIDS virus carriers are there right now in the United States?
Our next question is about that. Question number 6. How many AIDS virus carriers are there in the United States? A, about 100,000, B, about 500,000, or C, over 1 million?
The answer is C, over 1 million. We're estimating that there is about 1.5 million carriers at the present time. And those are the individuals that may not even know that they have the disease, but can still spread it. And there is where we need some counseling, testing, and then make sure that they know how to prevent them from spreading the disease to other people.
Can you compare it with other epidemics?
Well, one can look back to a few centuries ago, and I suppose compare it to the Black Death and the typhus and smallpox and a few things like that. It has not grown to that proportion yet, but unless we develop some cures and vaccines, certainly who knows that it has that potential of becoming that serious.
What this country faces, what the world faces, is a great unknown about the spread of AIDS. Nobody knows how many potential cases of AIDS there are, nor who will come down with it next.
Now, this is not a national epidemic, but a worldwide one. The World Health Organization in Geneva tracks all reported cases. So our next question is number 7, multiple choice. In the entire world, the greatest number of AIDS cases reported officially so far is in A, Latin America, B, Asia, C, the United States, D, Africa. Pick A, B, C, or D and mark it on your scoring form. Dr. Bowen?
Well, the answer is C, in the United States. And we have, as I have said a while ago, about 40,000 cases that have been diagnosed here. The AIDS has been found, however, in 113 different countries as of August of this year. Now, we are certain that some other countries have a lot more AIDS than what has been reported. But in the central countries of Africa, for example, we know that they have a great problem. We don't know exactly how extensive it is because the methods of diagnosis and the reporting systems are inadequate. So we have to say that we have more in the United States diagnosed now than in any other place.
Looking back over our first 7 questions about this epidemic, questions 1 through 7, for every answer you got right, give yourself 2 points on this test. Steve, how much did the public seem to know about this based on our survey?
Morgan, so far people surveyed in our Metropolitan Life Lewis Harris poll averaged 3 right and 4 wrong on our first test questions. Our high school students in Plainfield did a little bit better than the national sample. They averaged 4 right and 3 wrong. Now, it's important to say here that our Harris poll is a scientifically drawn sample of 1,000 Americans asked these questions in August. The possibility of error, about 5%.
Miss Helen Hayes.
This is the second time that an epidemic has struck me through those I love. I lost a daughter in the last big polio epidemic, and I went to work as best I could for fundraising, as all people in my way of life can do. And I found many other people who had been touched by polio working to eradicate that. And now I've lost two of my very dearest friends through AIDS. One was a friend I'd had for over 40 years. We had gone through so many good things together, and I can hardly think about it without breaking down.
Harry Hamlin.
I just lost a very close friend of mine not a month ago. And the hardest thing that I found in dealing with it was the inability that I had to pick up the phone and call this person and tell them that I knew, that I cared for them, that I still loved them, and that I hoped that they were able to cope with the disease in the best possible way. Every time I reached out for the phone, I was terrified. And I realize now that I should not have been.
Tom Hulse.
When I was in London, I saw a huge billboard that said, AIDS does not discriminate. I think it's crucial that we not get caught in we versus them, but that we acknowledge that it's all of us.
AIDS. Who gets it?
Who can possibly come down with AIDS? Who gets it? That's a question a lot of us want to know for certain. And that's what our next group of questions is all about. There are a lot of uncertainties about AIDS, but there are some things we do know about who's potentially vulnerable to this disease. Morgan Fairchild looked into the subject of who gets AIDS with this next series of questions in a report from Atlanta.
All right, now take a look around you. Walk the streets, join a crowd. You know, we make a lot of judgments about people based on the way they look, good judgments and bad judgments. You know, it's that old thing about trying to judge a book by its cover. What do you think? Any of these people carrying the AIDS virus? I mean, I can't tell, but I know the chances are increasing every single day that someone I see on the street will be carrying it. This is downtown Atlanta. Every major city in the United States is now experiencing major problems with AIDS. Now, you hear so much about men with AIDS, but I'm a woman. I wondered about women with AIDS, and that's our next question on this test. Question number 8. Women have a greater natural immunity to AIDS than men. True or false? For the answer, I turn to Dr. Robert Wyndham, Assistant Secretary of Health and Human Services. Dr. Wyndham, I have a good question for you now. Is it true that women have a greater natural immunity to AIDS than men? True or false?
That is false, Morgan. There's
Why?
no difference in the immunity.
Well, why is it that there are fewer cases of women with AIDS then?
Well, in the United States, that is true. But if we look, say, for example, to Africa, the incidence of the disease is equal in men and women. Mm-hmm. And the way things are going today, it appears that the women are becoming more and more infected, so that number will increase.
But if women have no greater resistance to AIDS than men, what about their babies? Are they in jeopardy? There are babies here. With any luck, the actuarial tables say that the little boys among them will live to age 71. The little girls will live to age 78. But what if their mothers have AIDS? What then? Question number 9. A pregnant woman with the AIDS virus can give birth to an infected child. True or false? Dr. Wyndham?
That is true. And that is one area of the transmission we're so worried about and concerned about, and want to have the mother be aware before she gets pregnant, and hopefully would not have that occur.
Do they have any idea what the percentages are of women with the AIDS virus delivering children with the AIDS virus?
Yes, Morgan, the figure that we know today is about 30 to 50% of the babies born, the baby born of an infected mother would become infected.
So it's not absolutely positive, though?
Oh, yes, it's not absolutely. It's 50% or less.
Is it possible for a baby to acquire the AIDS virus through the mother's milk?
There has been one suggested case that has happened, but the instance of that, of course, and documentation of that was not clear, so that we're not advising at all for mothers not to nurse.
So women don't get AIDS nearly as often as men. Only 7% of the people who have the AIDS virus so far are women. Well then, among American men, who gets AIDS? That's our next test question. AIDS carriers in the community come from a lot of different groups in the population. From heterosexuals and people who shoot up drugs, and gays. Now, which group do you think gets AIDS the most? When it comes to American men, the highest number of AIDS cases is among A, heterosexuals, B, homosexuals, C, intravenous drug users. This is question number 10. Dr. Wyndham, what's the answer?
B would be the homosexuals.
Do they have any idea why the disease seems to have entered this country by the homosexual community?
No, that is not known at all why that happened.
Safe sex is the homosexual's protection against AIDS. It was also the Broadway play by Harvey Fierstein.
We all have to know how to take care of ourselves and how not to spread the disease and how not to get the disease. If we as the gay community have suffered these incredible losses and these years of incredible pain, let it not go to waste. At least we have the answers now. We know, we don't know how to cure the disease, but we do know how not to get the disease.
Is Fierstein right? Have gays learned? In Washington, we turn to Dr. Anthony Fauci at the National Institute of Allergy and Infectious Diseases.
Well, I think that certainly the community of male homosexuals have done an extraordinarily good job in educating themselves and in responding to the educational campaigns of others regarding safe sex. So hopefully the increase in infection among the male homosexual population will plateau and go down. Unfortunately, what we will be seeing over the next 5 years is increase in the number of AIDS cases among people who are already infected with the virus. But it is quite true that male homosexuals have been changing their sexual behavior, becoming more monogamous and being more acutely aware of the necessity of safe sex.
Public health authorities are very disturbed about the sharp impact AIDS is having on the Hispanic and Black communities. So, our next question. About that increase of AIDS among minorities. True or false? Blacks and Hispanics are more susceptible to AIDS than other ethnic groups. Dr. Wyndham?
That is false, because no one is more susceptible, but there are greater proportional instances of the disease in the Black and Hispanics.
Morgan, I understand you talked with some Black and Hispanic health officials while you were in Atlanta, and they were worried about an AIDS backlash against them.
Oh, they certainly are, Steve. I talked with Ruth Rodriguez of the Hispanic AIDS Forum in New York and Dr. Rudolph Jackson, professor of medicine at Morehouse University Medical School in Atlanta.
I've received letters that said, God bless AIDS. It'll wipe out minorities. It'll wipe out gays. It'll wipe out IV drug abusers. And there will be that segment of the population, hardcore, that we may never get to when it comes to that kind of attitude.
This could so easily be used to justify feelings that have existed in this country all along that predate AIDS.
The rapid spread of AIDS, that ominous caseload increasing every year for the foreseeable future, raises an important social issue. Even if we're not personally touched by AIDS, even if it does not strike a relative or friend, it's still going to be all around us. Now, this is an opinion question, no scoring here. But how do you feel about this question? If it was proposed that an AIDS patient treatment and housing center be located in your neighborhood, would that upset you? A, a great deal, B, somewhat, C, very little, D, not at all? We'd like your opinion. Choose A, B, C, or D.
How did Lewis Harris and Associates find the nation split on this issue in our nationwide survey?
Morgan, a lot of people resist the idea of having a concentration of people with AIDS in their neighborhoods. 4 out of 10 said they would be upset a great deal or somewhat by an AIDS center near them. But an equal number, 4 out of 10, said it would not upset them at all. The rest said it would upset them only a little.
As to those scoring questions I raised in Atlanta, there's one among them that is especially important. That's question number 8, about whether women have greater natural immunity to AIDS. The answer is false. And 64% of the people in our survey knew that.
Hello, I'm Ricardo Montalban, and I would like to say something to you about AIDS, to all of you, but very especially to all my friends, the Hispanics, because I know something about our idiosyncrasy. I know that as parents, sometimes it's very difficult for us to talk to our children about sex. So what happens is that the children learn sex in the street, through their friends. Sometimes they get a wrong image of what sex is all about. And of course, one thing we must do with our children as parents is to warn them of the imminent danger that exists in promiscuous sex.
AIDS. How you get it.
Now, it's pretty clear from everything we read and hear about AIDS that people are worried. Many are downright scared about getting AIDS. It's contagious, but just how contagious is it? Can we compare it to other diseases that spread from person to person? Is it more or less catching than some of the so-called childhood diseases or other illnesses that used to reach epidemic proportions? Our next 4 questions deal with some of those comparisons. Actor and dancer Gregory Hines looked into all of this for us when he went to the Centers for Disease Control in Atlanta.
The Centers for Disease Control, or CDC, is concerned with the prevention and control of disease, all diseases, but certainly full-time on AIDS right now. Researchers here are disease detectives, keeping track of the spread of the AIDS virus across the country. They're also trying to find out more about how AIDS is transmitted and how to stop others from becoming infected. Dr. James Mason is the director of the CDC. Dr. Mason, I've heard about viruses all my life. AIDS has definitely been identified as a virus, a contagious virus.
That's right.
We have a lot of contagious viruses. For instance, this is a
measles virus.
Right, and measles is contagious.
Absolutely.
So that brings us to our next question. AIDS is more contagious than measles, true or false? AIDS is more contagious than tuberculosis, true or false? AIDS is more contagious than smallpox, true or false? AIDS is more contagious than the common cold, true or false? Dr. Mason, AIDS is more contagious than measles, tuberculosis, smallpox, the common cold, true or false?
False. We're comparing apples with oranges. These diseases, with the exception of AIDS, are respiratory infections that involve the nose and the throat and the lungs, while AIDS is a blood-borne infection that multiplies in lymphocytes. And it's not spread through the respiratory route, but through IV drug abuse, by sexual intercourse, and from an infected mother to her baby.
Our national survey results show that many people overestimate just how contagious AIDS is. Almost half thought it was more contagious than measles. More than half thought it was more contagious than TB and smallpox. Why do you think so many people perceive AIDS as so much easier to catch than these other diseases?
Well, I just don't think the general population really understands how AIDS is transmitted. They assume it's transmitted like a lot of other diseases that they come in contact with on a daily basis. AIDS is a different disease. It's a different virus, and it's transmitted, as I mentioned, through blood and sex and from a mother to a baby.
One of the many problems in talking about AIDS is that many